Please, Dr. Sohiel.
Thanks a lot. Good afternoon, all. It's a great honor for me to be with you today, and I welcome you all in the 13th Egyptian Venous Forum Congress, talking about comparative study of topical treatment for management of chronic leg ulcer, a multicentric study. I have no disclosures, and this is our publication. It's already in PubMed. You can see it for the whole study. As you all know, chronic leg ulcer represent a significant clinical and economic burden due to prolonged healing time, frequent outpatient visits, and high recurrence rate. Topical wound care is usually widely, and however, comparative evidence supporting specific topical agents remain limited, and inappropriate and prolonged use may delay healing or increase the complications. This multicentric study aimed to compare the effectiveness of the three commonly used topical treatment strategies in the management of leg ulcers. We had 125 patients with chronic leg ulcer who failed to heal in 4 weeks in 9 vascular surgery units across Egypt and Romania between July 1st, 2025 and December 30th, 2025. All patients were designed in the three groups. The first group with antimicrobial agent, the second group with hyaluronic agent, and the third group with a mix of antimicrobial alginate and hyaluronic acid. And all wound examination was examined and classified according to the grade and stage. Our results showed that the mean age ranged about 49 years, with 70 patient males and the rest are the females. Were divided into 22 patients in the first group and 33 patients in the second group and 68 patients in the third one. Prevalence of comorbidities and among the study population showed that 116 patients had signs of systemic involvement only in 15-1, who received systemic antibiotics according to the culture and sensitivity tests. Venous ulcer, which was the most common etiology in 54% of the patients, and management strategies included compression therapy, great saphenous vein ablation in 19 patients, 15%, and sclerotherapy patients, about 5%. And this was the wound journey, as you see in the pictures, till the complete healing. Ischemic patients accounted for 20% of the cases, with primary arterial intervention as angioplasty with or without stenting. Reported procedure included superficial femoral artery angioplasty, tibial angioplasty, combined iliac stenting with superficial artery angioplasty, and tibial angioplasty with minor amputation, and also combined arterial and venous cases. Traumatic patient also has a share with 3 patients, and you can see this patient of traumatic ulcer at the Achilles level, whom were completely healing with 7 weeks. Pressure ulcers, which is the disaster, was also in 7 patients with complete healing, occurred in 11.6 weeks in the first group, 14 in the second, and 9 in the third one. Two proportionate Z tests were performed to compare healing rates among treating group. Logistic regression analysis using the first group as the reference category demonstrated significantly higher odds of complete healing in both second and third group, with the strongest positive association observed in the third one. And these figures show a positive correlation between the ulcer size and the healing time, which showed weak to moderate positive linear relationship, and p-value of 0.007 confirms the relationship statistically significant. A NOVA test was performed to compare continuous variables across the 3 groups that showed no statistical significance in the baseline of the ulcer between the 3 groups, indicating comparable initial wound characteristics. In contrast, mean healing time differentiated significantly across the treatment arms, with significant combination topical third group. Conclusion, dear professors and colleagues, this study demonstrates that topical dressing choice influenced the healing outcome in chronic leg ulcers. Among the topical treatment, mixed combination formulas, the Zimulj 1, consisting of enzymatic antimicrobial component, alginate as debridement agent, and hyaluronic acid for moisture regulation, was associated with superior healing outcomes. These findings support a more evidence-based and individualized approach of topical wound care within the broader framework of comprehensive ulcer management. Before I go, I have to give a great acknowledgement to the co-authors of this study, Sergio Giannicini, the president of WUIB, Professor Pier Luigi Antoniani for his expertise insights, Sara Onidi for her support for the chronic wounds, Elena Granova, the ex-president of the Balkan Venous Forum, and my sincere gratitude for my dear brother Mohammed Farag for his statistical analysis of this study, all the authors and co-authors from the Egyptian Venous Forum family who shared in collecting and analysis of these patients and these data and follow-up of these patients till the end. Before I go, a sincere gratitude for Professor Mosad Suleiman for his support, and of course PharmaMart for giving the support for this study and ongoing relationship for the Zimulj, the third group. Thank you, and looking forward for a bigger Egyptian Venous Forum family. We started with this and ended by a full capacity room. Looking forward for a bigger rooms next years. Thanks a lot.